Welcome back, and thank you all for staying with us. And now, mid this week, the Health Minister, Ruth Aceng, led her team to the Parliament to request for approval of an 18.5 billion shillings supplementary budget for the initial procurement of the COVID-19 vaccine. This is part of the 59 billion shillings required by the ministry to procure 18 million doses of vaccine. These would then vaccinate 20% of the population, equivalent to 9 million people. Tonight on Talk of the Nation, we are joined by Allana Kembabazi of the Initiative for Social and Economic Rights. Welcome to Talk of the Nation tonight.
Thank you. It's good to be here.
Well, what do you make? What are your thoughts on the supplementary budget, the 18.5 billion shillings?
So maybe to first of all give some context, we've been asking government for very clear answers around Uganda's progress on the COVID vaccine. And we saw the cabinet sit, and we had the president briefly mention this in terms of saying Uganda is going to go a step further, and actually beyond working on its vaccine, we still don't know the progress of our vaccine, and beyond the allocation from the COVAX, which is this facility that is helping low-income countries get vaccines, mostly at like no cost, except the initial allocation is at no cost, Uganda will go ahead and procure. And then one of the things we then saw as a follow-up to that was again coming before Parliament. Looking at all of this, first of all, it's not clear to me if Uganda has, there's a cost here, and it was announced in the cabinet press release, and it's also here, which is $7 per dose for the vaccine, the AstraZeneca vaccine. And because there are 2 doses per person, that is $14. Then the other costs that they break down around actually handling the vaccine, transporting it. It is, first of all, not clear to me that we have even negotiated, this is the actual amount with the company. We haven't, it's not clear to us if they've actually signed the deal yet with Serum, and this is the actual amount. And if it is the actual amount, but from looking at what they put there, I think it is just an indicative amount, which should concern us. We should, at this point, have something more specific. But if it is the amount that we are working with, we should also be very concerned, because South Africa, which is a middle-income country, is getting a dose at $5.50. The EU is $2. And we went through a couple of countries as ISER and actually realized this would be among the highest in terms of costing. So that is something that we still are quite concerned about, because again, the cost does add up. I think now it's over 161 million when you actually add it all up in terms of the dosage. So that is the first thing that I will say is very concerning. We need to have a clear picture. Have you is this the price you have negotiated with the Serum Institute for AstraZeneca? And, you know, if so, why is it so high? And it could be that there are other dynamics. We've always talked about the fact that there's vaccine nationalism. There are very few doses left for low-income countries. But then this is something that would then be elevated, because last year, for example, when South Africa was saying that patents should be waived, otherwise, if you don't waive patents, the prices will be too high for us, for the lower-income countries. The UK said this is hypothetical. Well, this is a situation where we'll be having a higher price than people who have a lot more money, and yet we urgently need resources. I think the other element around the supplementary budget is, again, we've talked a lot about the supplementary budgets that we've been seeing in the COVID response, and I think sometimes we forget that they have to be unforeseeable, unavoidable, and I think absorbable. Let me double check. There are 3 criteria under the Public Finance Management Act. And so the question is, should it have come in as a supplementary budget, right? Given that this is something we've known countries are working at for a while. And particularly because I don't see from the supplementary budget I saw, I don't think they had to wait to figure out how much they would get from the Serum Institute, because it seems like they're referring quite vaguely, in my opinion, to sort of price guidance they've seen, and they refer to the UNICEF market, sort of pricing thing, which is tracking how much countries are paying. So I then wonder why this was not brought early. We don't want to have a rush decision making, because we do want Parliament to take time with this. We also want to make sure that if this money is passed, it is absorbable before June. And it's, again, not quite clear to me, because we did, in my opinion, delay in moving towards actually securing additional doses. Because for so long, we said we were relying on COVAX, but the COVAX facility, it was always clear, COVAX will not give you more than 20%, more than enough doses to vaccinate more than 20% of your population. So you'd have always had to look for more doses, right? So we should have seen stronger action on this. And then there's just a lot, if you look at the supplementary budget, again, it's a lot of you expect them to be a bit more certain. For example, they talk about, I think, in terms of delivery, they talk about storage and distribution, potentially with NMS. You know, at this point, we should have a bit more specifics, because you may say, okay, we were not able to get vaccines booked because countries were hoarding. But as you're preparing for vaccination, some of these things should have already been there. You should have been able to say, okay, so far we know that all the vaccines that are coming out require cool temperatures. AstraZeneca requires like fridge level, others like Pfizer requires super cold, so those ones will be really hard here. We should have already seen them from last year start to say, how much will it cost to transport the cold storage, you know, requirements, cold chain and all these things that we are still, I think government is now just rushing and starting to do these things, at least now, from the public's perception.
Well, you bring in the aspect of the fact that we're using funds from the supplementary budget, and this has been a concern of many. Do you think the government should have planned much earlier, considering that we knew sooner or later would need a vaccine way back in November 2020?
Yes.
And do you think this is likely to affect us, you know, going forward?
Yeah, I think that, again, this vaccine and looking for funds for it is part of the government's COVID response. We're seeing a real crisis in public confidence around that, particularly because we saw so many supplementary budgets. And I do recognize that some of these figures could not be gotten maybe earlier on, you know, because by the time we're doing our regular budget for this year, this was not necessarily ready to sort of, they didn't have the specifics of it. The new companies were discussing. But as soon as companies, I think, started to come out and say, okay, this vaccine candidate is happening, we should have seen that. And beyond the supplementary, we should have seen it in the budget estimates, right? Because again, the budget process, even for next year, has happened. The budget, the vaccination process, it's a process, right? You're going to do the initial rollout, then the next phase. So it's not like you're going to be able to put everything in this supplementary and then, you know, do it in March. I mean, later on, rather not in March. Do it later on, yeah, like maybe in March when you're preparing your estimates, your budget estimates, and in April, you know, the ministerial policy statements are going to be discussed. So you could, I think there just has to be streamlined planning, and I want to be very clear that I think for me it reflects the COVID response and the vaccine preparation. For so long, Ugandans just did not know what was happening around the vaccine. So you have to think about the people who are receiving this budget. They are Ugandans, they're policymakers. You've been relatively silent about a vaccine. After a lot of outcry by civil society, you then come up and say we're doing this, and then there's a supplementary. And in fact, the day you all broke the news about the supplementary, the public sentiment, particularly online, was quite negative. People were saying they're going to steal the money. Did we ever see the masks? You know, and I think it's because, again, there has not been that engagement. Because I do think that COVID, we know for a fact, we've known for a really long time that having a COVID vaccine is one of the quickest ways to better economic recovery and to sort of getting slowly back to normal, to getting kids back to school, to really fully opening up, right? And it's part of, it should be part of the government's overall prevention strategy. And so as much as they talked about masks and distancing and all of those things, they should have been talking about the vaccine early and giving us updates. If, for example, last year they said, Uganda is aware of the things, right, much earlier, and we seem to be stuck, but we are looking and we're getting prepared. We are looking at our cold chain requirements. But what you'd hear last year was very little and uncoordinated sort of discussions around this. And this year, like last week, I think was the first time we had, this past week rather, something that is a bit more comprehensive. And we have to think about, again, because it's a whole process, and this supplementary budget does talk about how it will roll out to districts. My question in all of this is whether or not they have consulted the district, the officials at the district level, because it might be, you know, your requirements to get someone in Amdat or in Sigulu Islands vaccinated might be different from someone in Kampala in terms of how much more do you need to transport it safely, the health workers, the training of the health workers, right? So when you have all these issues at the back of your mind and you're actually consulting communities, ideally our budget process should be something that is informed by consultation of communities. And that is why the regular budget process as is often preferred. Now with these supplementary budgets, they're devoid of that consultation. They're done and they often have to be passed. Again, there's often an urgency to it. And that when that happens, there's very little room for questioning and issues around, you know, will you actually be able to absorb these funds? You know, will they actually trickle down the way they need to the last mile? With a regular budget process, civil society is often able to go there and anyone else, but with supplementary budgets, it's a bit harder again because of the timing. So they're often past the void of participation, and for me, it's a thing that I'm really against.
Well, Allana, thank you so much for sharing with us your thoughts. And as we come to the end of this conversation this evening, we would like to pick your thoughts. We are looking at, sooner or later, we need about 44 million doses. What should we be putting in place to ensure that every single Ugandan gets a chance to be vaccinated?
Yeah, I want to start off by saying, first of all, the government has to get more vaccines, right? And they should do this in two ways. They should continue these negotiations, and we should actually have clear negotiations around what the prices are, and should later
so that people trust in the government.
Yes, but also so that we know if we are getting a raw deal, because like I said, for example, $7 a dose is higher than South Africa. It is higher than the EU. Does that make sense given our limited resource base? But number two, it should be joining the other African and Asian countries that are saying, listen, waive patents, because we need to be able to have generic companies produce these vaccines at a low price. And we have not had the president join in that strong support for people's vaccine. And then when it comes here to the Ugandan situation, right, making sure that you're preparing to vaccinate people. One, you're engaging with communities, such that you know the barriers and the needs. We've seen community engagement has been often left out in the COVID response. Two, you are making sure that the vaccines are free, because it doesn't help if you decide that. I had, for example, yesterday, someone, the health committee, saying that the vaccines should be available at a cost for those who can pay. What does that mean? Won't we see a replication of what we are seeing with testing and treatment? Someone today, right before I got into the show, was telling me, Mulago is only for the real. If you're badly off in this country, you will die of COVID by yourself. So we have to make sure that they are free. And number three, that again, government has begun to do the training that needs to happen for the health workers. It has looked at the cold chain storage requirements. And it is also making sure that at this point as we start, I would strongly urge government does not outsource this to the private sector, because what we saw with testing and treatment, once it was outsourced, it became a purview of those who have some resources. So as you start, because you're dealing with an environment with very few vaccines, please make sure that you're firmly in control and you have clear criteria. You're making sure that you're not going to prioritize a soldier over, for example, a child with cancer. So.
All right, thank you so much, Allana Kembabazi of the Initiative for Social and Economic Rights, speaking to us on the 18.5 billion supplementary budget. Well, thank you as well for joining us. You too can send us your thoughts in our comment section, NTV Uganda on Facebook and NTV Uganda on Twitter. We'll be looking at those your thoughts. You're still watching NTV Weekend Edition.